against the many challenges that face the health services, the Percy Junor Hospital in Spalding, in the northeast section of the parish of Manchester, continues to be a beacon shining in the south. The hospital, which was built and donated to the government of Jamaica by Spalding businessman Percival Sigismund Junor in 1945, is administered by a group of persons who are constantly searching for ways to fulfill the vision of making Percy Junor the best customer-friendly institution, providing comprehensive quality care in a clean, healthy and pleasant environment. Various innovative and creative measures have been undertaken in the last 2 years by management and staff, community members, business entities and friends to serve the over 250,000 persons from the parishes of Clarendon, St. Anne and Trelawney.
The mission of the Percy Junor Hospital is to provide reliable and affordable quality health care for all our customers, both internal and external. This year we are happy to report our customer service training. We had 100% training. We also have staff members outside of the health services or outside of the professional department where attended training. We had attendants, we had drivers, and we had administrators, to include myself. We also have our complaints mechanism, and this is more vibrant and is being very well managed by Miss Sharon Peter, our Patients Affairs Manager.
In 2007, a linkway was built between the Spalding Health Centre and the hospital with the kind help of Guardian Life. This linkway now means there is easier access to the hospital for persons in wheelchairs, on stretchers and also pedestrians, eliminating the dangers of being on the main road.
We continue to get increased commendations from our external clients, that's our patients. We have less complaints from our internal clients. We also have an increase in our library books, increased internal audits for quality assurance, improved staff morale. We were certified with HEART NTA, and our waiting hours has been reduced from 7 hours to 3.5 hours.
Reading can be very therapeutic, and so the hospital introduced its library services in 2007 and has since accumulated over 4,000 books, which are readily available to both customers and staff. This innovative service is aimed at encouraging reading and promoting literacy. Over 40 books are borrowed daily by about 75% of the staff and the patients. The hospital also offers CXC-level subjects at their evening institute to staff, their children, police officers and other members of the public.
We really offer maths and biology. I'm the maths teacher. We started 2002. It all started when my son was hospitalized, and I thought this was a way to give back to this hospital. So a lot of the nurses who were ENs wanted to become RNs. They needed to pass mathematics. So that's why I started the class. I decided to do it just for 1 year, but the success has been such that I have just continued since then. So it has now become a household part of the hospital program.
The Stop and Think Violence Reduction Program, which was introduced in 2006, has also been extended to include other schools in the region.
The long-term goal is to develop a school-based violence and reproductive health program that lets the medical team, the social workers and the psychiatrists actively intervene in managing these problems, because these problems aren't just isolated instances. They have social roots, they have roots in the community, they have roots at home, they have behavioral issues and also medical issues. And we feel that the only way to tackle these problems effectively is to understand and intervene at all these levels. Unfortunately, nowadays we deal with the end product of violence, but we hope to try and intervene before the violence takes place and prevent these life-threatening injuries.
The hospital also now boasts its own Central Sterilization and Storage Department, CSSD, which allows them to do their own sterilization of equipment and to assist other facilities in the Southern Regional Health Authority.
I tend to visit the hospital quite regularly to look for various community members. And you get the feel that they feel that you're home away from home because the environment is so clean. The level of healthcare has been boosted by the whole moral of the staff, improving. I've heard one patient say, boy, it has moved from customer service now to guest care because you feel as if you're at a hotel facility when you're at Percy Junor Hospital.
With all sincerity, I think that apart from being a training institution for nurses, other category of workers from other health institutions should come by and see what is being done, because I think it should be the standard by which hospitals are judged.
The Percy Junor Hospital, defending champion and winner of the Jamaica Civil Service Association Trophy for the most creative, innovative agency 2008-2009.